गर तू मुझे नवाजे तेरा करम है वरना तेरी रहमतों का बदला मेरी बंदगी नहीं। काशी टीवी देखने वाले सारे व्यूअर्स ਨੂੰ ਮੇਰੇ ਬਲਬੀਰ ਕੌਰ ਰੰਧਾਵਾ ਵੱਲੋਂ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਸਲਾਮ, ਨਮਸਤੇ, ਗੁੱਡ ਮਾਰਨਿੰਗ, ਗੁੱਡ ਆਫਟਰਨੂਨ, ਜਿੱਥੇ ਕਿਤੇ ਵੀ ਤੁਸੀਂ ਕਾਸ਼ੀ ਟੀਵੀ ਦੇਖ ਰਹੇ ਹੋ। ਦੋਸਤੋ, ਲੈ ਕੇ ਹਾਜ਼ਰ ਹਾਂ ਹੈਲਥ ਟਾਕ ਸ਼ੋ, ਜਿਹਦੇ ਵਿੱਚ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਸਾਡੀ ਫਿਜ਼ੀਕਲ ਹੈਲਥ, ਮੈਂਟਲ ਹੈਲਥ, ਇਨਵਾਇਰਮੈਂਟਲ ਹੈਲਥ ਦੇ ਨਾਲ ਸਪਿਰਿਚੁਅਲ ਹੈਲਥ ਦੇ ਬਾਰੇ। ਅੱਜ ਅਸੀਂ ਇੱਕ ਸਪੈਸ਼ਲ ਮੁੱਦੇ ਤੇ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਹਾਂ, ਇੱਕ ਸਪੈਸ਼ਲ ਅਵੇਅਰਨੈਸ ਦੇਣ ਬਾਰੇ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ, ऑटिज़म अवेयरनैस, जो कि साढ़े काफ़ी जोड़े व्यूअर्स ने जानना चाहते सी ऑटिज़म के बारे। तो लाइफ जी हैगी है रियलिस्टिकली जोड़े लोग ऑटिज़म अवेयरनैस के बारे असी जो गल करते, जोड़े लोग जीवन च देखते हैं कि किस तरीके के नाल डील करना उन्होंने दे बारे अज थोड़ी जी गलबात करांगे। पेरेंट्स हो गए, चाहे केयरर्स हो गए, सो अलग अलग प्लेटफॉर्म पर जो असी किसी डिजीज़ के नाल या कोई चैलेंजिस जी साड़ी हैल्थ रिलेटिड है, चाहे वह मैंटल हैल्थ है, इन्वायरमेंटल या स्पिरिचुअल दे बारे हैगा, उहदे बारे असी जो गल करते तो असी जानना चाहते हैं कि वो चैलेंजिस साढ़े लाइफ दे विच किस तरीके दे नाल आए सी ते किस तरीके दे नाल असी डील कीता सीगा, ताकि जिन्हां ने डील किया उन्हां तो असी कुछ प्रेरणा लै सकीए, उन्हां दे असी टिप्स यूज़ कर सकीए, उन्होंने किस तरीके दे नाल अपने संघर्ष दे विच की शामिल किया जिन्हां दे नाल उन्हां दी जर्नी थोड़ी जी ईजी हुई। क्योंकि जिहड़ी कोई भी डिजीज़ होए, कोई भी चीज़ इदां दी हुंदी है जो जिहड़ी साडी हैल्थ रिलेटिड हुंदी है, उदों साडी जर्नी उदों बनदी जदों असी थोड़ा जिहा उहदे तों रिकवर हो जांदे हां ते असी उन्हां दी जर्नी जिहड़ी हैगी शेयर करदे हां दूसरिਆਂ दे नाल, उदों असी काफ़ी हद तक उहदे तों राहत पा चुके हुंदे हां। अज दी जिहड़ी साडी ऑटिज़म अवेयरनैस जर्नी हैगी है, एक साडे जीपी है उन्हां दी है एज ए मदर। सो अज असी उन्होंने इनवाइट किया है, शी कम फ्रॉम अ रियली फार टू गिव अस अवेयरनैस ऑन ऑटिज़म अवेयरनैस। डॉक्टर राजेश्वरी जो कि एक जीपी ने ते एज ए ऑटिज़म मदर भी है, इन्हां दे 2 बच्चे ने, एक वड्डा बेटा जिहड़ा इन्हां दा उन्नू ऑटिज़म हैगा। सो अज असी इन्हां कोलों जाणांगे कि इन्हां दी जिहड़ी जर्नी सी एज ए ऑटिज़म मदर किस तरीके दी रही, क्यों की चैलेंजिस इन्हां ने देखे ते किहड़ी-किहड़ी जिहड़ी चीज़ां सी ਉਹ ਇਹਨਾਂ ਨੇ ਅਪਣਾਈਆਂ ਤੇ ਉਹਦੇ ਨਾਲ ਉਹਨਾਂ ਦੇ ਬੇਟੇ ਨੂੰ, ਉਹਨਾਂ ਦੀ ਫੈਮਿਲੀ ਨੂੰ ਉਹਦੇ ਤੋਂ ਹੈਲਪ ਮਿਲੀ। ਸੋ ਇਹ ਸਭ ਜਾਣਨ ਲਈ ਅਸੀਂ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਕਾਸ਼ੀ ਟੀਵੀ ਤੇ ਡਾਕਟਰ ਰਾਜੇਸ਼ਵਰੀ ਜੋ ਕਿ ਜੀਪੀ ਨੇ। ਸੋ ਥੈਂਕ ਯੂ ਰਾਜੇਸ਼ਵਰੀ ਕਮਿੰਗ ਟੂ ਕਾਸ਼ੀ ਟੀਵੀ and providing us on very valuable important topic which we're going to talk on autism awareness as your mother's journey.
Hello, thanks Balbir, thanks everyone. Good afternoon all. I'm Rajeshwari Murali. I'm a GP by occupation living in West Yorkshire, mum of a lovely boy Bala who got a special needs, who is 21 years old now. It's not an easy journey for me. My son Bala had a diagnosis of autism at the age of 3. It's a devastating news. Since then, my struggle had started, balancing between my career, life, everything. And I'm standing in front of you. In this journey, I lost my husband in 2019 due to cancer. Grieving while raising these 2 children, I got another boy, Sanjay. I faced a lot of challenges, but I successfully faced and balanced my personal life and career. So I'm here to share about my journey and give some suggestions for mom of all special need children. Thank you, Balbir.
Thank you, Raji. So you came from a really far place as well, 2.5 of traveling to come and see and us at Kashi TV and provide awareness on very important topic, autism. Raji, when we talk about autism awareness, we have many challenges as a parents, but as a mother, you know, all mothers who are watching, what do you think is the difference between a normal mother, we call so-called normal mother, and a mother whose child has autism?
Thank you, Balbir. Everything is different. It starts from play, communication, interaction, and interpersonal skills. Everything is different. Autism children, they don't communicate in a normal way what other normal children do, and they got other sensory difficulties as well. And some children they talk, some children they don't talk. So as a mother, parents, we have to first understand how difficult the life is first understand and accept the autism diagnosis is very important. Starting from primary school and giving a special education and giving a special toys to engage children, everything is different, and family support is very important. Not only parents but also the family members around them have to support, otherwise it's very difficult. Is there any other area particularly you want me to cover about?
Firstly, I will say, as when you were as a mother diagnosed about your child, your son has autism, doctor told you, how did you receive that news as a mother? That was your first child, and finding out as a family, what was their reaction when you told my son has autism? How do you think our Asian community take it? Or what was your experience as a mother seeing your child as autism when you mentioned to somebody, oh, my son has autism, that's why he's doing this, or he has speech delay, or he's doing this certain thing because has autism? How did you feel about it?
It is a devastating news. It's not an easy diagnosis, because my son started talking at the age of 1.5 to 2 years, single words, not sentences. But I can started seeing him going back to his milestones. Like he stopped talking, and he developed a toilet training, but he lost that skills. So we can see, the skills what he had developed, he is losing the skills. As a parent, I felt, oh, what's wrong with my son? And eventually, after 6 months of extensive investigations and things, eventually we found that we got the diagnosis. I can't believe, because my family, no one has got the diagnosis. Everybody is fine so far. I only know the term autism in the book. And first time when I had the diagnosis, and when the specialist mentioned, not only this boy, eventually you might get another boy with the same diagnosis in future if you want to go ahead with it. It is devastating. It's not an easy diagnosis. Not only you're handling your son, but also you have to, there is a huge future in front of you, staring at you, what you are going to give in terms of education, what you are going to do in terms of engaging him. And especially Asian community in India, like third world countries, you don't have a special schools. So
his diagnosis was in India or here?
When I was an obstetric doctor before, so I had my training in obstetric gynecology in India. By the time he had all the regressing milestones, when I finished my training, I came to England. By the time I had the suspicion, but the diagnosis given in UK.
So how old was he when he got diagnosed with autism? 3-year-old.
3-year-old.
So did you find that, because our show goes worldwide, do you think there is more people understand about autism in England compared to our Asian, countries, India, Pakistan or Bangladesh? Do you think there is a lot need to be presented to give awareness on autism in those countries compared to when we compare England? Like today we press autism and we have so many information available, but if you write in Hindi or Punjabi or in Tamil, we find really limited information which we really needed. What do you think about that?
Definitely. When my son had the diagnosis, I started searching up autism. There is not much information in India. I spoke to my college friends and other doctors. My own sister-in-law is a psychiatrist, but I haven't got much information. When I have to come to England because my husband was in training here. When I rejoined, then I started collecting information from health visitor and social worker and community services. The community centers.
Yeah.
By the time I was in Newcastle, still remember, the health visitor was the first one mentioned to me, these are the services available. You can go and get this information. This is the pathway to diagnosis. And after that, my son will go to special school. So she gave me all the information. Asian community, the Asian women, I wasn't aware of because I didn't born and brought up in this country.
Yeah. So how did you feel? Did you feel a big relief having a knowledge like, oh, my son can go to school, my son can? Did you see a future when there was the information available?
Definitely, definitely. That's what I'm telling. Autism awareness is very important. What parents face is the fear of future, fear about future, rejection. So, if you give more information, these are the support available, then it will be a big relief. When I realized that he has a school, he has a college, he has future available, I have respite available, carers are available to look after my son when I go to work. So these are, information given to me when I felt very happy. So I can be a mother, I can be a GP, I can be a carer. So I can do whatever I want to do. What else I need?
Absolutely. So, Rajeshwari, when you find out your son was 3, he had autism, and how did you feel it yourself? What was your mental health state that time? Did you do something to cope with autism? You find out because it's a big news. I don't know how much knowledge you had as a GP because you was in medical field, but there is many women's who doesn't know even autism what it is.
Absolutely.
There is the first time they're hearing, probably in your medical years, you learn few things about autism, not as being a mother or somebody you care for autism. So how did you feel? What was your first reaction to autism?
Initially, to be honest, though I'm a medical professional, I didn't understand the real meaning of autism. I have to accept that. And how it's going to affect my mental health and family health, I didn't much aware of it. And I would say that I was in a low mood for many months. I wasn't taking any medication because mental health is underrated in Asian community.
Absolutely, agree with you.
Yeah. So when I realized after many years, oh, I was in depression. I didn't realize that. I really surprised. I said, though I'm a medical profession, I had been through this situation. I can imagine how, normal women, not a non-medicos, how they are taking this diagnosis and how they are processing it. It is hard.
So, as autism mother, as a GP as well, sometimes we have this a big issue going on due to MMR. Certain people get autism, or there is a certain things you have in your genes as well. So do you ever thought about that? Or because of MMRI, my son could be got autism, or is because of in my family, or due to the gene he's having what he's having? Or do you think it's a nature way of having autism? Did all these things come in your mind, like other mothers, when something comes, you're going to check everything?
Yes,
did you do the same process, or
yeah, I'm a mother first. Yes, I did all the research. Is anything run in the family? Is my husband's side, my side? Did anything wrong? When I was pregnant, anything I did wrong? So I did the same like any normal mother would do. But to be honest, there is no proven etiology, which means the cause for diagnosis of autism. Anyone can get it. Very important thing is recognizing that, and how to intervene in an early stage. It's very important.
Thank you so much, because that's a quite hard question sometimes to answer, and sometimes we are not very truthful saying, because because of our being in medical side. So from professional, as GP, as a mother, hearing, I think our listeners who are watching us as well, they will learn that it's not MMRA, it's not environmental, it's not your fault either, because sometimes we tend to blame, because of me, I've probably done something in pregnancy, or something has somebody done as well. So it's nothing to do with that. Any culture, any religion, any person can have autism. That's the first thing we should bear in mind. It doesn't see it's a black, white, yellow, green. So anybody any child can have, and sometimes it can be diagnosed late as well. So that's totally different scenario where adults are getting diagnosed with autism as well. So Rajeshwari, once you got the diagnosis, so how did the society, around you, people, when you're taking your son to, it's not easy journey. So what challenges, especially when he was growing as a little baby, was there to see as a mother?
I faced a lot of challenges, especially we'll start from home. Like playing is difficult. I can't leave him alone to go to kitchen to do the cooking because I don't know what he's going to do. He tear papers, he chew papers, so he eat non-edible things. He play with everything. So I need to avoid danger, like sharp things. I need to move away from him. He need a 24/7 supervision, day and night. Sometimes he will get up in the night, middle of the night, and come down to sit down in the lounge. So I need to lock the kitchen. I need to lock the fridge because he will take food outside, not only eat but also play around. So he got sensory difficulties. And taking him to the birthday parties are very tricky because his behavior, other children looking at him differently. He will sometimes run around hyperactive. He do self-harming. It's non-stop, never-ending list.
As a mother, when the child is toddler or becoming, going to infant or nursery, that age is very, very important, 3-year-old. And not many people will see as an autism, and sometimes, a professional will say, give us some time until, because there is a lot of things related to autism, which can be, as a learning disability or can be a speech delay. So how did you, thought about, what do I need to make a plan for myself? Or was you quite a lot isolated in your bubble with your family only, where you think, I have to do this, and that's it? How did you manage that time?
Very difficult. First, I will make a priority list. I will plan my day. Like if my son goes to school, make sure I'll prepare for him to go to school. If I'm going to work, and organize a carrot for my son, and everything I'll plan, prioritize plan. I keep revising the plan. It's easy, I'm telling now, but it's
looking back,
it is exhaustive, very exhaustive list, because you have to be a mother, do household things, and you have to work as well. And on the top of it, like, you have to look after a special need boy. He will generate work all the time, round the clock. So you need to balance everything among all your work schedule as well. So it looks exhaustive, but in that journey, I would say it developed my skills, my organizational skill, my time management, problem solving, everything. I learned a lot, like how am I going to cope up the situation? What are the extra resources available for me? I asked help from my husband and carer support, and I talked to my family members. In all throughout this journey, I try to keep my mental health in safe place. Like I develop a strong mental willpower. Okay, I'm a mother of a special need. It's okay. I accept the truth. I accept the diagnosis. I accept my life is going to be like this. Okay, what am I going to do next?
Great.
Yeah.
So these are the challenges which you face, and you have this planning. Okay, I'm going to do these things. But do you think that people need to be more aware on those things? You shouldn't, have to suffer. I wouldn't say suffer. It's like you did problem solving, but from my point of view, when I see, it's a lot of suffering you have coped with, whereas life could have been easy when the support is straight away available. But is nothing come in the plate serve, as we say.
No.
We have to sometimes struggle and get what we want. Our chosen food has to be very basically.
Yeah.
But looking at your journey, Rajeshwari, this small child, 3-year-old, got diagnosed, and then you're getting support for not only supporting your child, but for yourself, thinking how I'm going to manage my family. And your relatives around you who has different scenario, no help available. Seeing yourself as a main carer provider for your son, and it's a big challenge.
It is.
It's a very big challenge, and especially you still had little bit knowledge, but I think there is many women who doesn't know anything about how to manage the time. They are struggling. Some are very single parents and they are uneducated. But one thing I have seen in my career, Rajeswari, that mothers tend to find a way to find help for their children.
Definitely agree. I don't know how to answer this question, but as I said earlier, at some point you have to help yourself. You are the first person to help you.
It's like a friend talking to a friend, isn't it? It's a mirror talk when you're a mother of a special need. You're seeing in a mirror, I've got no help available, I have to help myself, no matter what I can do for best for my child.
Yeah.
Girl or boy, I'm going to do it.
Yeah. I mean, you can juggle between. Sometime I take a little time off in between. Like I plan my timetable. For example, if I have a hard shift, like a long day shift, I'll take a time off half a day the next day to give myself treat. I don't do anything. I just chill out, send children to school, I relax. Right. I take a cup of coffee, I'll watch my favorite movie. Watching movies is my hobby. Okay. And I cook my own biryani, that's my favorite. So So I give a treat to myself. Give a small treat in between your struggle days. Like, after school holiday, I take a little break because I know school holidays are toughest time to handle kids.
It's a long time.
It's a long time. But I will take a tiny break after school holidays. Okay, so I take my annual leave, not continuously, I'll take in between. So I work half days now, but before I used to work full day. Now I'm working until 2 o'clock. After 2 o'clock, I don't do anything. I go to gym, I relax, cook, clean, wash, whatever I feel I wanted to do, I'll do it. And
that is nice way of treating. I think self-love, what we call, is very important when we have special need child, or when we are coping with any disease or health related or mental health issues. Self-love giving is the most important thing that we can give a gift of, isn't it, Rajeswari?
Definitely.
Rajeswari, when your child was grown, as after 3 he become 5, 6, 7, so I will go about 7-year-old when he's in little bit older. What kind of things he was struggling that time, through speech and language, communication barriers, or behavior challenge you've seen in your child, and how did you deal with it?
It is a hard time again, but in my son loves swimming. I realized he likes to go to swimming, so I'll take him every day swimming. So in that way, I started relaxing myself. So my hobby and my son's hobby together,
combining
together. So in the way I relax, whatever I will work around him and the family. Okay, so every day I'll take him to swimming. If I can't, I'll ask my husband before taking to swimming, or ask carer to take him to swimming. So you not only relax yourself, but also make sure family members are happy and contentful in their way. I give him a good treat, like his favorite food, and whenever I feel like whichever way I keep a little plan, divide my son's emotion in 3 different directions, one is red, amber, and green. I try to keep him in a green zone always. I know when his mood goes to amber, I know that his facial expression is not in the right mode. I try to bring it back to
To the
green.
green mode. Okay.
Green mode. I realized it works for me as well. When I becoming amber, I will treat myself and becoming more good.
I need to be in green zone.
So my son taught me a lot. My son taught me.
This is a very good skill, actually. It's for any human being. We
Yeah.
should have red, orange, and green
Yeah.
mode for ourselves. So when we think, oh God, I'm getting into orange,
Yeah.
before I go in red, I need to go into the green.
Definitely,
Go.
yeah. So I see my son as a very positive, and he's a strength to my life. He taught me a lot. He made me a multitasking woman, career woman, and if you told me 10, 15 years ago, like you're going to become a GP, I laugh at you because I don't have a skills of a GP, but I changed my career because of my son, because GP career is suitable for my lifestyle.
Yeah.
So he made me to change it to a career, which means if I can do it, I have the potential to do it. So he made me realize how strong I am. He made me realize how organized I am, my time management, planning, everything he gave me. I am seeing as my positive, side of my strength. So
absolutely.
yeah.
So there's, everybody says that there is there is a hand of women to be famous. Every man who is famous, there is a hand behind is women. But in your case, is your son is behind you?
Yes, definitely. Definitely my son. And I want to talk about my husband too. He's not with me at the moment, but I would say that he wanted to see me as a independent woman. My son's difficulty should not obstruct me, so he was very, very, very strong about it. Like, he encouraged me, and I can't forget, these two people are my strength and my positive side of my life. So I will tell all the parents who got a special needs, so don't see your children as your weakness. They are your strength. They are your strength. And see them as your positive side. In that way, when I grown up like this, so if I can, then anyone can.
Absolutely.
Yeah.
When you talk about your husband and your son, those mans in our community now, it's very difficult sometimes for a man to adjust their son or daughter has special need. Did you ever come across seeing as a GP, as a mother, men more strictly avoiding autism rather than women?
I heard many stories like women struggled because they not get recognized of the because of the son's daughter's diagnosis. It is a poor thing. I think they need to they have to develop awareness. It's no one's fault. It's no one's fault your son or daughter got a diagnosis. You have to support them, actually. If you support them, they can shine.
Absolutely.
Yeah.
And we must say, autism children they probably need lifetime, help or some, certain activities. But some of them have, talented as well. They have a special talent, which can be art, music, cooking. If they are specialized in one thing, they can flourish. All you need to is that sharp eyes who can recognize the diamonds.
Definitely. There are higher functioning autism there. You have to give appropriate support. They can become an artist. They can be a musician. They can be anything. Even what do you call it as Thomas Alva Edison is a autistic special need child when he was young. Yeah.
There is many autistic famous people when we see, and I just wanted to say that autism children have a different view of seeing people. That doesn't mean they are mentally ill. they have different way of saying things. The way you, me, or Rajeshwari is saying, they see a very detail of person, and there is a lot of artists who done amazing work. Their glance of eyes, they did the art, and they see in one glow, they see a picture and they can create even very small detail in few seconds. So they are very detailed person. They can see what we can't see. That's why when we are talking to them or listening to them, they can observe your aura so quickly. Are you going to be positive towards them or going to be negative as well? So that's why autism is very sensory side of CVC as well, because they can hear, see, and smell things quite, obviously from other people. What do you say about that communication, Rajeshwari, when we talk about, is your son is verbal, non-verbal? How does he communicate?
My son is a non-verbal, very difficult communication. I have to pick up from facial cues, whether he's happy or upset or in a different mood. We are trying to teach him mechaton, but it didn't work well when he was young.
Okay.
But eventually, as a mother, I learned his language. Of course, parents, they know how their children behave and react. So I design his day, I design his environment. Before him, I look around the environment and make sure it's appropriate for him. So I know it's a hard work, it's not a easy thing, but eventually it gave me a special skills, like without telling, identifying, facial cues. It helped me actually my career too. When 10 minutes
Excellent
appointment,
skill.
excellent skill. 10 minutes, 3-4 minutes, I recognize what they want. And
amazing. So did you ever use picture exchange or anything?
We tried.
So you tried. So mainly it's the body language you observe and look at it.
Yeah.
Does he use any
picture exchange? He does with the school, but he learned in a way it's only for school, not at home.
Okay, so that's their way of,
That's
it's going to
way
be
of
only used
communication.
and that's it. I'm not going to use that.
No. But I would suggest that every child is different. Every child is different. So you assess your child. You plan for your child. You know your child better than anyone, even a teacher.
I will agree with you, as what you mentioned, what you know about your child. Only even professional can give you guidance. You can follow and see if it's really relevant to your child or not. But at the end, you will be the one who will be dealing your family, your husband, your partner, or your sibling. So coming on sibling, how did, when your second son was born, how did your first son with the autism actually, how did they came together? What was the reaction to him?
Oh my God, it's a tough journey. When Sanjay born, second boy born, Bala wasn't very happy because he knows the other little child in the home.
Okay.
So he used to cry, jump, and he broke 3 cots, it was a hard time. Then that time only he started doing self-harming. Eventually he realized mom is going to see me first, like I will see my first boy, like Bala first, then Sanjay. So he know that he will be given priority. Even now, Sanjay will wait. Bala is my first priority. He always my first priority. Whoever there in the house, he is my first priority. As a mom, I want to give him the best. Even Sanjay, I know that. Even he got 2 cakes. First, he come and give it to Bala. I mean, my first boy, who got a special need. Then only he'll take his share. He know that he will be the first priority in the house.
That's so sweet. So Rajeshwari, as coming to Sanjay, how does he feel? As a mother, you can see your child, your first child is, Bala is different than Sanjay. There is 2, for you are mother, and mother is always going to be go for a special one. How do you feel his, way of saying things to? Is he different to, child who has normal sibling? Does he do extra things? Sometimes, they can spoil children as well. Oh, my brother, I'm going to do this extra for him. Do you think there is that kind of thing I'm going to do for him because he has special need, or they are just like a sibling, normal sibling? They're going to fight, they're going to do all those things. So how is it different for them?
They have a very good understanding. Bala and Sanjay, very good understanding. Even I can leave Sanjay next to Bala even when he was a child.
Okay.
He won't touch Sanjay at all. Even he is in the floor, he will walk around. He never even jump. He never go closer to him. Bala is such a lovely boy. He got a good reputation in the his school and things. Like he never touch anyone. He harm himself, but he never touch anyone or push anyone with intention. So they have a very good relationship with each other. Sanjay knows mom will give a first priority to Bala, and Bala knows like okay, whoever there, I've been given my chances, so I don't have to worry about.
It's all about being safe, isn't it?
Yeah.
When they feel
Yeah.
safe, they
Yeah.
are more flourish.
Yes.
When we talk about self-harm, so when Bala used to do self-harming, because there is a reason for doing self-harm. Either we are not understanding, or environment is changed, or could be a sensory issue. How did you cope as a mother with the self-harming? Did you had a special team to work for it? Did you ask for advice, or did you check on internet? What was your way of helping your son with the self-harm?
Okay, it's a very good question. I think many parents wanting to know this. I will do the systematic assessment. What is wrong? Anything went wrong? Any physical injury? One time I noticed that he had a little wound in the leg. It was bleeding. I think he had some injury, and it hurts him a lot. So I check him first. Any physical harm anywhere, like any soreness or boil, or any physical injury causing him, upset. Then I looked at environment, and anything, any or any noises make them upset. And is he hungry? Hypoglycemia could cause, upset to people, because they can't go and take food from the kitchen. Obviously, you have to feed him. So, is he hungry, or is he tired? He didn't have a good sleep at night time. Okay, so you have to do a systematic assessment, like what is wrong. Does he need a change? Personal care, nappy need changing or anything? Is he got temperature? I'll ring the school and check anything wrong with the school. Anybody upset him? Why he's upset at school? Sorry, at home. So you do the systematic assessment, like what we do when we are upset. We will assess the situation. Anything wrong? He doesn't like food, or he likes something and which I didn't offer. For example, one time I got a big chunk of muffins, like I think 5 tons, something like that, a group of muffins. Like I gave one to Bala, one to Sanjay, and I put it on the cupboard. He want more, but I didn't offer him any. He waited, then started self-eating. Then I realized he thought everything was him, like it belongs to him, and I didn't give him his portion enough. So he thought like, okay, it's a way of communication. So parents have to understand it's a way of communication. He's trying to say something to you, what it is.
So every behavior is a reason behind certain things which is not getting met, maybe. So we need to just recognize if the child's behavior, adults' autistic behavior is changed, there is always a reason behind, which we need to recognize. So we're going to come a little bit more further, Rajeswari, when he was becoming a teenager. Teenager, I'm sure, is a very big challenge itself. Your hormones changing, your atmosphere, you're becoming a man, more muscular energy. How did you feel you didn't have that time your husband's support?
My husband passed away when he was a teenager, 14.
So how did you cope with your husband's
demise? Yeah.
And challenging behavior, teenager, and you go a small child. There is as well. So what was encouraging you to all those things? 3 things basically you are coping: a bereavement, a child with autism, and you got young child and yourself. It was very challenging conditions. So how did you manage, and what kind of challenges did you face?
To be honest, I don't know how I managed. I'm very positive person, I would say. I want to live for my children, especially Bala. When my husband passed away, my first goal was I need to be alive until my son would cross 18 because he would get a adult support team available for him. That was my first goal. And I wanted to clear my exams because I need a financial support to run the family. So I need a stable job to run the family. So I have to be alive for my kids. They are my strength.
Wow.
It's not an easy
not
journey.
easy.
But two little young children looking at you, they got a hope that you are doing something to do for them. So what do?
So you were a role model. If I cry, they don't want to see a
No,
breakdown.
when I cry, my eldest one starts self-harm. I never cried in front of my son Bala. Because when I cry, he will start crying and start doing self-harming. Even if I want to cry, I have to say, I go to shower and cry in the shower. So
It's not easy journey.
It's not easy.
And I will say to our viewers who are viewing the journey, every parents, just like Rajeswari, she was qualified GP. I'm sure there is many parents who going through maybe more difficult journey than that as well. But remember that the more strong you are, the more better for your children as well and for yourself, and never give up. Never give up. Like Rajeswari, if she given up, she was looking at those two children's eyes, 4 eyes are looking at me. That made her what she is, and that's why she's here at Kanshi TV to tell us everybody can do what I have done. And Rajeswari, what, as you're saying, you want it there for your children. I'm sure you're going to be many more years supporting them, and we will be calling you again on Kanshi TV as well. Journey of a teenager, as going to a college and school. Normal parents think so. My son or my daughter's going to go to college, then they're going to go to university. You want it for your son for at least 80% support. What kind of support parents are looking when they go a special need child, and what do you think should be there and they should be qualified to get it?
Good question. I asked this question when my son was a teenager. After school holidays, I had a really hard time, and I went and asked that CAF lead and said, do I have to be like this rest of my life? Because when normal child crosses 13, 14, you can leave them alone at home. You don't have that luxury. We don't have that luxury. And when they crossed 18, they don't live with you. They will go to job and they support you as well at some point, but you don't have that luxury. I want all the special needs mother, parent needs to get the same freedom, luxury and support what normal children, parents, parents who have got a normal children. Do you get my point?
Yeah.
I know it's possible. Is it available or?
It's like that's the whole point for us doing autism awareness. That we want every parents, whoever is carer, because not for autism, we're not going to be always there for them. One day they will grow, we get old as well, and we're going to die. That's the true fact. But what we are looking after is that once we left this place, when we leave happily, we know our children are in better hands. That's the whole mission, isn't it?
Yes.
So now I'm going again to the question which many parents will think about non-verbal. What do you think, when Bala was non-verbal? Do you think he understand everything what you were saying to him, or do you think he wasn't understanding, basically only understand you, what people were saying about him, he didn't understand?
most of the thing he doesn't understand.
Okay.
And but he has improved a lot over the years. But he look at me. Sometimes initially he didn't have a good eye contact at all. It is hard time. But what Bala usually does, like he will take me to the place what he wanted. For example, he wants something from the cupboard. He will take me physically over there. He doesn't want to exchange pictures. Non-verbal autism is very, very difficult because you don't know, are they in a pain, are they in a hungry, tired, what kind of. So as a parent, I'll make sure he feed well, like he will drink well, and he makes sure that I observe his toilet training, when he go to toilet, like I make a note, keep a diary, his mood diary, everything. I will keep a diary from top to bottom the whole day, 24/7, and ask the carrot to write as well what he did. And I'll keep a hobby time as well. Like I'll plan his day. It is really really difficult. Like as I said, like you need to assess systematically, like why he's getting upset. The whole point is make sure they are happy in a day, contentful day. And also at the same time, I need to be more productive on the day, like as a mother, as a GP, as a carer. I also want to have a good day in my life. Yeah.
So it's working all together now.
Yes.
As a in a partnership, you can say,
Yeah.
Bala and you,
Yeah.
and Sanjay as well, as you three living together.
Yeah.
So you giving Sanjay time and Bala and yourself,
Yeah.
and being professionally as a qualified GP as well. So there is so many things
So
happening,
many.
but you are managing because of your problem solving skills you have. So I would like you to give some skills which I think going to be useful for our viewers who have special need children or adults, how they can have those skills to improve their lifestyle as Rajeswari has improved hers. So which skills you used for yourself, Rajeswari, you're going to share with us today?
Okay, yeah, definitely.
And if we can share, like we can resources as well, what kind of resources as a parents you will recommend it to our
Okay.
viewers?
Okay, definitely. Like I started noticing what kind of positive I have got. So look at yourself. Are you a teacher, doctor, qualified professional? Make sure you do things to keep your profession. It's for your mental peace as well as you need a financial support. Okay, so try to balance your personal life, good work-life balance. Okay, create a support from not only home but also from workplace. Make sure, let them know you got a son with a special need, and get us appropriate support from them. And make sure some people, they are not aware of, they got a carer sleeve, they got a carer credit. If they are single mom looking after special need, make sure they should aware of their benefits what they have got in community. And what other skills I would say, like you know uh, you make sure you utilizes your resources. For example, your family members, supportive family members, get help from them.
Absolutely, I agree with you.
Yeah.
Especially make a plan is like you said, diary. Even if you go, there is a passport called hospital passport is very important when you're going for appointment.
Yeah, definitely.
So they can carry the passport, which is like give you brief information to whoever is caring for your child or adult. Their information, what they like, what they don't like, and how can if you are not there, what things make him or her happy. So you got some points. Which is highlight points when he's in a care or she's in a care in a hospital or care home or wherever the child is. they can see that passport and they can relate the information to the child to help him to settle, because sometimes parents are not there and suddenly sometimes can be emergency situation where the child need to go to hospital. If they have the hospital passport, it's very important, so they can straight away see, and it's easier to attend the appointment because they know somewhat children with autism doesn't like waiting time. And as a GP, I will ask you, what things can parents do? Like, the appointment time is very, restrict. So what tips you will share with our parents who has autistic children or adults? What can they do to get the appointments more in calmer atmosphere?
Okay, let the surgery knows that is a special need child. He need a double appointment, and quiet times. Maybe sometimes are busier in the mornings are busier. Maybe quieter time in the afternoons if they need. And also separate room. Many surgeries, if you tell them in advance, they can put you in a separate room. And also make sure that the child has got the diagnosis in the major list. Sometime when they open a system 1, it will pop up, this child has got special need, and then they need a double appointment, they need an interpreter. So there will be a pop-up coming when the doctor open the, or the receptionist open the appointment.
Okay.
So you make sure it is on their system available for them to look at whenever they go into the, patient records.
So these things are very helpful because most of the children doesn't go to appointment, especially if they have autism. If they had bad experience, they don't want to go to the same place. But how did you deal with like regular routine? They don't like sometimes teeth, checkup and eye checkup. So how do you easy apply for all kind of appointments?
Maybe going to the same physician in the GP surgery as well as the same dentist would be helpful, because they know that whenever they see that physician or a doctor, okay, the child will recognize, okay, I'm here to get my teeth checked, or oh, this is a doctor going to see me because I know them very well.
So it's better to have same person
Again,
or have a video.
Yeah, video. You can give a photo. Some parents, they will take a picture of the doctor, and as you said in the hospital passport, put it in the front like a that environment, GP surgery room or anything, like a get a picture so that they recognize, okay, I'm going to go to the hospital appointment. Okay, so it's earlier you give information, they process.
Okay, thank you so much, Dr. Rajeswari, for coming today to Kanshi TV and providing your journey with autism awareness today. Thank you so much. Any message, quick message you want to share?
Parents, you're not alone. Be strong. Thank you.
Thank you so much for coming. And दोस्तों ये दिन हाली साडा आज दा हाउ टॉक शो इतने समाप्त होंदा मिलांगे नेक्स्ट वीक किसी हो गेस्ट दे नाल तद तक के लिए मैनू दो इजाजत।